Lakeisha Brown was in her early 40s when she was diagnosed with heart failure. A mother of 4, she needed a life-saving option and became her own self-advocate, seeing several doctors to find the right treatment. Now, we're fortunate today to have Lakeisha joining us with Dr. Philip Adamson, Chief Medical Officer at Abbott's Heart Failure Division, to tell us the rest of her story and more. Now, Lakeisha, what symptoms did you have that made you go to the doctor in the first place?
I was having shortness of breath. At night, it became increasingly uncomfortable for me to lie down. It felt as something heavy was on my chest. That brought me to the urgent care clinic, and they referred me to the first cardiologist that I saw. At that point, seen a total of 3, but they did not provide me with any type of treatment plan or explain to me the severity of my situation, what was going on with me.
Oh, wow. Okay, so Dr. Adamson, please explain what heart failure is, and is there a way to avoid it?
Heart failure happens when the heart simply can't pump enough blood to the body to meet its needs. And there are a lot of medications and treatments that we have for people with heart failure, but many times the symptoms go unrecognized or blamed on other diseases or other disorders. So diagnosis can sometimes be confusing, and especially when heart failure attacks younger people, it just doesn't come to the top of mind of doctors. It's important to understand that heart failure kills more people over the age of 65 than cancer does. So it's a very serious disease process that can receive quite effective treatments. Unfortunately, in this country, less than 10% of people get those treatments.
Oh, wow. Okay, Dr. Addison, so tell us about treatment options for heart failure, and specifically the one that Lakeisha received.
We start with medications, and they're really well-designed medicines that go inside the heart muscle, help it get stronger, help it from getting worse, because time is of the essence with this disease. It gets worse over time. Medicines decrease that progression, the rate of that progression, and can be quite effective. When the heart failure syndrome gets worse, it can get to the point, like Lakeisha mentioned, where people are having shortness of breath at rest or at nighttime. They can't ever get comfortable. We call that advanced heart failure. And for advanced heart failure, there are very specific treatments like transplant. Very important intervention for advanced heart failure. Unfortunately, there's not a lot of hearts to go around, and the Abbott's HeartMate 3 device, which is an assist pump that can be permanently implanted in the heart, and actually is a pump that helps the heart pump blood to the body. And that device can prolong life, improve quality of life, and restore essentially the functional status that heart failure takes away.
Wow, that is a really impressive device. Lakeisha, how did you feel after the device was implanted, and how are you feeling now?
I noticed a change almost instantaneously after receiving the Abbott HeartMate 3. I was able to breathe a lot better. I was able to walk and exercise, and I'm back to doing a lot of the things that I was doing prior to me getting really sick. I've been able to go back to the gym and catering and cooking and spending time with my family. So it's been great.
That is fantastic. I was actually going to ask, would you be able to get into the gym, but we just saw there that you're actually able to get back in there. That's fantastic. That's really, really cool. Yes. So, Dr. Adamson, what do you wish more people understood about heart failure, and how can it be treated?
I really wish people would understand that heart failure is a very serious disease. It's one that can be treated. It's one that can receive really effective therapies. But many times people are not their own advocates. They just simply take what they get. And I think I really would wish that every single patient with heart failure could become informed about the treatment options, become informed about what they have. It's their disease, it's their treatment plan, and having information that would help them really understand what's out there for them and what can help their lives get better and longer is very important.
So, Doctor, where can folks go to learn that information?
Well, there's a website called DoMoreForHeartFailure.com. DoMoreForHeartFailure.com is a great resource. You know, there's a lot of online stuff, but DoMoreForHeartFailure.com can give a lot of links and other information about heart failure, its treatment options, and it can start the process in this journey of surviving heart failure.
Excellent. Well, thank you both very much for your time. Lakeisha, you look fantastic. I'm so glad you're doing so very well. This is really cool. I appreciate you taking your time your morning to spend with us. And guys, you know, if you want to find out some more information or watch this segment again, you can head to our website.